I'd like to invite our last panelist today, Michael Keeling with the NCC for Healthy Public Policy. So before Mike comes on, I have a question for you. Mike is going to be talking about ethics and opportunities which we have public health and other sectors to actually operationalize justice as we respond to the pandemic. The question for you is, what are you observing for all participants? What are you observing, or what are you concerned about in terms of some ethical issues in current pandemic responses? And again, this reflects some of what you shared with us when you registered. So folks talked about concerns around resource allocation and how those decisions are going to be made. Lots of conversation, which I'll call here structural violence, and really how the faults in our current system really being exposed. Barriers to digital access, which Nellie spoke to earlier, and also transparency, really how decisions are getting made in this climate, especially as decisions are being made very quickly, in many cases with very little consultation with communities, which we know is quite important when we're talking about policies being really responsive to community needs and desires. All right, great. So lots of you mentioning resource allocation, and the others seem to be resonating. I'm seeing a few people there indicating that you have other ethical issues on your mind. If you can share those with us in the chat box, that would be really interesting to see those. Thank you. Okay, so now I'd like to welcome Mike to the floor here. So Mike, what are you seeing as some of those opportunities for public health and other sectors to really bring forth this idea about justice, which is really foundational to equity as we respond to the pandemic in real time and also beyond? And you'll talk a bit about some of the sort of ethical principles and approaches which can help guide our decision making now and beyond COVID-19. Thank you.
Thank you, Sue. I hope everybody can hear me all right. If I'm not loud enough, please send me a note in the chat or something. I'll try to speak up as best I can. My focus in my work is on public health ethics, and I've been, generally I work on things that are not necessarily related to pandemic ethics or emergency ethics and so forth, but lately, obviously, I've been, like everybody, I've been really closely following the discussions that are going on around COVID-19 and specifically around ethics. And there's such an overwhelming amount of information right now, it's very difficult to keep up with it all. Happy to say that my center, my NCC, has managed to pull together some resources on the issues related to this pandemic. And along the way, I've been trying to pay attention to equity, to Indigenous health, intersectional approaches, and global health. Now, just stepping back a bit, one thing about this that's I think essential is that the time to think about ethics in an emergency situation is before the situation itself. And when we're talking about equity, equity has to be built into things beforehand and not on the fly. So based on the work that I've been looking at over the past while, and certainly in the past month or two that we've been focusing on COVID-19, I've pulled out 4 main themes that I want to discuss briefly today. The first one is triage, or allocation of scarce resources. And there's an obsessive, almost obsessive focus on this issue right now, because obviously our health systems are potentially going to be overtaxed, and as those systems prepare for surges of patients, they have to plan for those shortages, like ventilators, ICU beds, etc. And they have to choose who gets those and what's fair. So underlying all of that is justice. And the focus, in general, tends to be on figuring out a way to balance both efficiency and equity. And unfortunately, the more stress upon the system, the more that equity will tend to be put aside, because efficiency will be about maximizing the number of people saved with those resources. And it's a strict numbers game. Equity, on the other hand, will have its focus on marginalized populations, or on those who might not have been treated fairly by society, or the least well off. And many of the folks in those situations may need more resources than average. So you can see that as the pressure cranks up, the numbers game would have people perhaps leaning towards, in some frameworks call for this, go for the most people possible and sorry about equity. Okay, so that's just a kind of overall concern. If you set that aside for the moment and take a look at some of the competing criteria that are proposed within triage frameworks or triage decision-making models. Some of the different criteria, some of the main ones that I would see, one is giving priority to younger patients because of the potential loss of more life years. So that's seen as being something to value. Or the focus is on the people who are in better health to begin with and more likely to recover. Or the focus is on prioritizing healthcare workers because they're instrumentally important for saving other people or because they put themselves in a dangerous situation in the name of the common good. Some would have us focus on marginalized populations. Some would call for random choices in certain circumstances. I just want to raise those, and there are some other criteria as well, but those are some of the main ones that come up. And I don't want to evaluate those right now, but you can see the problem here because in a system under extreme stress, decisions are going to get made about which lives to prioritize, and the risks there are enormous. Now, just before I move on to the next theme, I want to mention that there's a real caution to be had about triage discussion, and that is that triage talk presents you with a dilemma. It says, we're in a situation where it's either this or that. We've got extreme scarcity. But it has us tending or tempted to not call into question the validity of that dilemma in the first place, because we can still call into question the social dimensions of this or the underlying conditions that give rise to this scarcity. And I think we should do this. This is questioning. So a region might be overwhelmed by a surge of cases, and it's possible that there was nothing that could have been done about that. But the cases may well, they're also relative to the preparation that was made, to the capacity, and to other factors. So those factors may have come into play in determining how you ended up where you end up. And these reflect policy choices as well, and collective decisions as well. So when we're faced with dilemmas like triage decisions, it's also important to ask if this situation was inevitable and necessary. So there's an emergency situation, and the way to plan for bringing equity into focus and the way to make sure that it is treated seriously is to make sure that we learn our lessons and to make sure that as we plan for life here, that these considerations do not get undermined along the way when things are quieter. So a triage plan is a backup plan for when prevention fails, and that's something to keep in mind. Very briefly, the second theme I want to quickly touch upon, and it's something that certainly arises from the literature, is that of structural violence. This pandemic reveals, and we hear this quite often in the media, and it amplifies the inequities that were already there. We don't hear it enough, but we do hear it. One way that I understand how inequities play out is through the idea or the notion of structural violence. And very succinctly, that would be the set of social structures that would assign higher risk and shorter lives to some people or to some populations and not to others. So a couple of quick examples. Paul Farmer is excellent on this. If you're familiar with him, he writes about low-income rural Haitians and how they are consigned to early death based on who they are, but basically by virtue of the situation in which they're born and live and the conditions that take them one place or another. Or the people who end up in Russian prisons for petty crimes connected to poverty, because in certain areas, prison would be like a death sentence due to rampant tuberculosis. For an example from closer to home, and this is not Paul Farmer, but an example that many of us are familiar with is the death of Brian Sinclair in 2008 in Winnipeg, in an ER. He had a treatable infection, but as a low-income Indigenous man in a wheelchair, he was ignored for 34 hours and died of his infection. Now, those are not pandemic specific, but there are so many examples right now of a kind of social triage that's going on during this pandemic. We're seeing examples in the news every day. And I mean, maybe we can list some in the chat if people want to start bringing up some of the issues around that might fit into this kind of a viewpoint. Both the virus and our responses to it are affecting people in different ways, depending on who they are and where they're situated. So I want to underline this. Persons who enjoy multiple forms of privilege, as I do, are much, much, much safer right now. I recognize that I'm so grateful that I'm at home and I've got a job. Anyway. So the third one I want to touch on very quickly is global health. Health equity is grounded in justice, as we know, and it's about receiving a fair share of society's goods or opportunities, or maybe you could say the possibilities for having health and for living a good life, the fair distribution of these. We should also talk about solidarity when we think about justice, because it's solidarity that helps us to be a little more clear about who we're talking about, who is us, when we consider how far do the requirements of justice extend. So in a globalized world, this is a really big deal. And right now, COVID-19 is stressing the rich nations' health systems, and it's simply terrifying to think of what could unfold in low and middle income countries. The U.S. has something like 170,000 ventilators, and there are countries that have 0. So in a global bidding war for medical supplies, not just ventilators, but pretty much you name it, the richer countries win. And I treat this situation as a test of our global solidarity, and we need it. Because from a global health or a global justice perspective, what we're in right now is also a dress rehearsal for climate change. This is no small thing that we're in right now, but there are other issues that are going to have, they're going to call upon similar kinds of response from countries and from systems. So I'm probably over time, so I'll just close with the last point about being very proactive, and I kind of touched upon this at the start. The time to deal with the ethical issues that arise in emergencies is before they arise. And so one really important thing about equity and with respect to pandemic planning, it means working with communities beforehand, especially marginalized communities, so that you can at least try to ensure that the interests and needs of different communities are represented in what comes out, and so that policy responses and plans will be socially acceptable in their DNA, and that's good for equity. So I'll just leave it at that for the moment. Thanks.
Great. Thank you so much for that, Mike. I was talking to a former colleague yesterday, and she asked if I was feeling hopeful by some of the responses we're seeing in terms of policies and things like that. And you just reminded us that the time to plan for this disaster is before it ever hits. And I'd like to invite all three of you just start responding to some of what you heard. And Mike, I'm going to have you go. So what you're talking about in terms of pandemic preparedness, this is not new, right? So after SARS happened, there were lots of reports out here saying exactly a lot of what you're saying today, but we haven't moved on it. So from your perspective, how do we keep this on the agenda once we're all, communities reopen, we can all get back on the streets, and many of us can get back to our regular lives? And how do we keep it on the agenda?
It's a really good question, thanks, and it's a really hard question to answer. As we started into this pandemic, when it started to really preoccupy Canadians' attention, I was initially quite heartened by some of the things that I was reading and hearing on the radio and so forth, because it looked like a lot of the lessons, or some of the key ones from SARS were being spoken about and were being taken seriously. For example, I heard more this time around about the importance of reciprocity. And you might think about reciprocity with respect to healthcare workers, or you might think about it with respect to people who are being called upon to stay at home in order to flatten the curve. So the discussion was more visible and present with respect to, okay, given that healthcare workers have the duty to care, we have a duty to make sure that we protect them. I think that that's been something that's been understood. On the other hand, it may not be appropriately realized in material terms. And this is connected to, partly connected at least to, the way in which when there's a crisis, everybody steps up and we have these, we're seeing a massive response in Canada. And if and when this thing is fades away for a while, and we can't say what's going to happen with this one, but for example, in the wake of SARS, in the wake of the crises with Ebola in West Africa, in the wake of H1N1, over time, the interest fades. And over a little bit longer term, the funding starts to be cut away again. So this is just in the health systems and in pandemic preparation. There's a whole other set of concerns related to people being supported in life such that if trouble comes, you're able to withstand it. And it's just social determinants of health stuff. If we're going to try to ensure that Canadians are able to basically survive, but there are all kinds of ways in which people can do better or worse when something like a pandemic or another kind of emergency arises. If we don't have equity built in from the get-go, so social justice plays out importantly all the time, and it plays out even more importantly when we have a crisis. I should stop there.